Hello, my name is Ava, and I'm a nurse practitioner student. And today I'm going to do a HEENT assessment. This is my son. I will be doing the assessment on him. Um, I'm going to wash my hands, give us some privacy. Are you okay with me doing an assessment today?
Yes.
It should just take a few minutes. It'll be from your head down to your throat.
Okay.
Do you have any questions?
No.
Great. All right, so first we're going to start off by looking at his skin. We come in, we look at his skin. His skin looks smooth. There's no blotches. The color is true to his ethnicity. The temperature of his skin is warm. There's no moisture. There's no edema. The turgor is good. It's elastic. There's no bruising, no scarring or lesions. There's a few nevi. But other than that, the skin looks good. And then we'll next take a look at his head. And we just want to, can I take this off for just a second?
Okay.
So we just want to feel around. Okay. Okay, the head size is normal. The head size is normal. Hair distribution is even. The hair color, he does have some hair coloring in his hair. The hair texture is normal. There's no lesions, masses, gross depressions, or no infestations in his head. Now I will palpate his temporal arteries. Okay. His temporal arteries, there's no tenderness. So we're going to move on to his lymph nodes. I'm gonna have you pull your hair back just a little bit so I can examine the lymph nodes. So I'm gonna have you turn just a little bit. All right, so we're gonna start off with the pre-auricular. I'm gonna use my 3 fingers here, and we're gonna go behind, that's post-auricular. And then we're gonna go back to the occipital, and then down to the tonsillar, down to the submandibular, to the submental, and then to the sublingual. We're going to go down to the cervical. That's the anterior cervical, and then the posterior cervical. And there's no nodules, lesions, growths that I can palpate. Also, we're going to check the 5th cranial nerve. So I'm going to have you turn. And what I'm going to have you do is clench your teeth. Great. And I'm going to just palpate his masseter muscle. It's tight, but I feel it right up in there. Great. All right, so what I'm going to do next is sensory of the 5th cranial nerve. So I'm going to have a sharp side and a soft side. So I'm going to have you close your eyes, and you tell me whether it's sharp or dull.
Dull. Sharp. Dull. Dull. Sharp. Sharp.
Great. So his 5th sensory nerve is intact. Next, I'm going to check his corneal reflex. And that's where I'm going to use this little cotton tip applicator. I'm going to put it close to his eye. And it causes him to blink. Next, we're going to check the 7th cranial nerve, the facial nerve. Um, we're going to check symmetry on his face. His face is symmetric. Um, let me have you smile for me. Can you frown? Now, raise your eyebrows. Now, puff your cheeks. And try to hold the puffed cheeks, even though I'm hitting you. Hold it tight. Okay, great. And now pucker your lips. Great. Now close your eyelids and when I try to pull them up, you try to hold them back. Great. That's good muscle control. All right. Now the sensory part of the seventh cranial nerve is taste. So we're not going to do the taste, but we would normally do probably sour, something sweet. All right, so next we're going to look at the patient's eyes. I'm going to take a look at his eyelashes, his eyebrows, and the papillae fissures. Okay, so his eyes are aligned symmetric. The hair distribution on his eyebrows and eyelashes are good. He does have a scar here that breaks up the eyebrow a little. There is no discharge from his eyes. There's no swelling. I'm going to look at his conjunctiva. Conjunctiva is white. There's no foreign bodies or nodules in his eyes. So next we're going to do cranial nerve number 2, the optic nerve. And the way we do that is to do a Snelling test. And this is to check vision. So the way we would do the Snelling test is we would hold this up about 6 feet away, and he would read it off to me, and we would see where his vision was. How far would you be able to read from here?
The bottom.
Okay, great. Can you read those letters all?
LTFPH.
Great. Now, if someone had 20/60 vision, that would mean that you must be 20 feet to see what a person with normal vision can see at 60 feet. You can use corrective lenses to correct that into 20/20. Next, I'm going to do a field confrontation test. So, what I'm having you do, you're going to look at my nose. I'm going to hold up different number of fingers. You tell me what number I'm holding up, okay?
Okay. 2, 2, 3. 1.
Okay. All right. A little bit of vision stuff going on that side. Now, what I'm going to do, I would normally dim the lights, but it would be too dark in here. So I'm going to test direct and consensual pupillary response to light. So I'm going to get my pen light. Open your eyes up. Open your eyes. All right. So what I'm seeing when I'm doing that is that his pupils do constrict with the light. His pupils are round. They're equal in size. And they are reactive to light and they accommodate. Now I'm going to do the 7 gazes to check his eyesight also. So I'm just going to have him follow my finger. So I'm going to have you watch my nose and then watch my finger. And you see that his eyes are following my finger. So that is the 7 gazes. Next, I want to do an ophthalmic exam for red reflex. And normally you would stand like 12 to 18 inches from him. And what I'm going to be looking at is his fundus, the vessels in his eyes, and his optic disc. So I'm going to shine, well actually I'm going to shine the red light into his eyes. Open your eyes up for me. Okay, so we see the red light. I did see the vessels and the optic disc. Now I'm going to do an inspection of his ears. And what I'm going to do, I'm going to first just take a look at him, make sure they're even, they're symmetric, there's no growths. Do you have any tenderness?
No.
So there's no deformities, no growths, no external discharge. There's no swelling or lesions. So I'm going to now take the otoscope and take a look inside the tympanic membrane. Look at the other side. Great. So what I'm seeing in there is there's no discharge in there. The membrane looks pearly gray. I saw the cone of light and then the malice, the contour. There's a contour to it and no perforations. So next, I'm going to palpate the pinna. Okay, there's no growths or lesions or no swelling. And then I'm gonna palpate the tragus. Okay, there's no swelling, lesions or growths there. Great. So next we'll move on to cranial nerve number 8. This is the vestibular cochlear nerve. And we'll do a whisper test. So, can you hear that?
Yeah.
Great. All right, so he should be able to hear out of both ears with that. Next, I'm going to do the Weber tuning fork test and what we're going to do with that. We have a tuning fork. And I'm going to put it right here. You let me know when you stop hearing it. Okay. All right, so next we will check the ren, which we're gonna go behind the ear on the mastoid bone and check the rennie. So we'll do this. There we go. Okay. Let me know when you stop hearing it.
Stop hearing it.
Okay. You hear it now?
Yeah.
Let me know when you stop hearing it.
Stop hearing it.
Okay. And we'll test the other side.
Hear it. Stop hearing it.
Can you hear it now?
Yeah.
Let me know when you stop hearing it.
Can hear it.
Okay. So this tests the bone hearing, the conductivity through the bone. So he hears well through tissue and bone. So we're checking for air and bone conduction there. So next we'll look at the nose, and we will check to see if it's symmetric. We can see that it's a little off because he has had a bone fracture that's caused it to kind of tilt to the side. I'm gonna have you tilt up for me. So I'm looking at septum. Septum seems even. There's no deviation. The nares is patent. The mucosa was pink and moist. There's no swelling or tenderness, and there was a slight discharge. The turbinates were pink. There was no swelling. So next, we're going to look at his throat and the mouth. First, we'll inspect the lips. The lips are moist and pink. There's a scar on the lip. Also, we'll look at his mouth, his teeth and gums. So I'm going to have you open for me. Okay. So oral hygiene is good. Soft palate extends to the hard palate. The uvula is midline. I'm going to look up under his tongue to look at the floor of the mouth. There's no lesions, growths. Also look in the buccal mucosa. I can tell when he bites his cheeks. There's no lesions, growths. The mucosa is pink and moist. We looked at the floor mouth. The pharynx is without lesions. We also, let me check back in here. I'm going to check to look at your tonsils. His tonsils are present. And I'm going to check the gag reflex. So what I'm going to have you do, say ah, ah. Okay, gag reflex is intact. Soft palate and the uvula are symmetric, and he has phonation. This ends my exam. Thank you. Thank you.
All right, thank you.